Welcome to the second instalment of our Creating Hope podcast series by Suicide Prevention Scotland and Public Health Scotland. I'm Rob Kelly and I'll be hosting our chat today. Before we start, I want to flag that we will be talking about suicide and some listeners may find this distressing. We have included helpful notes and sources of support, and at the end of the episode we will provide you with some telephone numbers if you're worried about yourself or someone else. The Creating Hope podcast is aimed at people working to prevent suicide in local communities. This episode will focus on data and intelligence. What is it and how does it inform our work? So let's get started by meeting the panel for this episode. Andrew Murray is a Principal Information Analyst at Public Health Scotland and leads the team who provide us with the more timely data reports and many other useful reports. Mary Grace Burinski is a Senior Health Promotion Officer in Fife Health and Social Care Partnership, working as a local suicide prevention lead with years of experience. And lastly, Shirley Windsor from Public Health Scotland is a suicide prevention oracle, but has the official title of Organisational lead and is a strategic outcome lead for Suicide Prevention Scotland. What do we mean when we're talking about data and intelligence? Because to a lot of people listening to this, they'll hear these terms bandied around, but they might not be sure what the difference is between data and intelligence or what we mean when we're actually talking about it beyond some of the hard numbers. So does anyone want to give us an idea of what the difference between them is?
Yeah, I'd been thinking about this one quite a bit before we started the podcast, and I mean I've been working in the organisation for about 10 years now, and lost count the number of times people have used the terms interchangeably, like data analysis, information intelligence. They are different things. They're all kind of steps on the journey to intelligence, I think. But a lot of people will say, like, oh, could we have some data on, for example, under 18s admitted to mental health hospitals? What they really mean is we want to know about under 18s going into mental health hospitals. We want to understand why they're going in and what we can do to help, stop that. But if I was taking them at their word, I would just give them a big spreadsheet, essentially. So I find like kind of data is the starting point. It's essentially just recorded facts. That is what data is. So when it comes to suicide, our kind of main biggest source of suicide data in Scotland is the Scottish Suicide Information Database. That has information on everybody who's died by suicide in Scotland since 2011, their names, their date of birth, their date of death, method of death, and a whole host of other variables. That's data. And by itself doesn't really tell you anything. You can kind of glean some stuff from looking at it, but essentially to a lot of people it's kind of hieroglyphics. You take that and analyze it and you start understanding it more. So you can start looking at, well, how many are male, how many are female, for example. So we know that 75% of people in the database are male. We can see that about half are aged 35 to 54. 75% are single, divorced, or widowed. And we can see that people in deprived areas, living in the most deprived areas in Scotland, are more likely to be on the database than people in the least deprived areas, in fact, 3 times more likely. So that's kind of analysing the data to get information that tells a story, but the really tricky part in that journey is taking that information and turning it into intelligence where we can actually make decisions based on what the data is telling us. And as a data analyst, that's where I feel like it's really important to work with people who have expertise in the subject matter. Like I said, I've been in the organisation 10 years. I've worked across a number of different topic areas. So I'm not an expert in suicide, I'm more of a data expert. But to get to that intelligence part, it's really important to get the perspectives and the contexts from people who have knowledge of that particular topic area.
I wish I'd met you years ago.
So I suppose how I look at it is the intelligence is the overarching strand and data is one part that informs what we will do with that information. Because I think that's, and we call it kind of like generic term intelligence. It's not meaning it's any better or any worse, but it's how can we be informed about what works and what matters most to people. whether it's actually that hard data in terms of the numbers, but also some of the qualitative work that we do. So by that, I mean about learning about people's experience of how they use systems, and then what do we do about it. And I'm sure Mary Grace has got something to say at what she does at local level in terms of that.
Well, I was just going to say that I think what's really interesting is that our interpretation is all quite different. I think when just asked that same question, because to me, I think the intelligence is a bit like you're saying, Shirley, the softer side of it. So it's like what we know at a local level that's not hard and fast facts and numbers, but it's like what our local context understanding of the local areas are, which adds another layer of understanding how the data applies. So I think, yeah, it's really interesting just hearing the different perceptions of that same question and how we all interpret it.
I suppose it's bringing together kind of like a bit of the principles of what we have in Creating Hope Together about what do we know from academia, from data, what do we know from lived living experience, and what do we know from practice about how do we bring together that intelligence cake, so to speak, and what's the most important thing is then what do we do with it rather than sitting twiddling our thumbs or sitting on our hands, etc.
Yeah, I'd agree. It's one of the big challenges of working with data, and my team kind of work from a national perspective with our publications and whatnot. But having worked with colleagues at a local level in terms of suicide and what it means, we don't see that context. We don't have that contextual information. So it's people with different skill sets working together to turn that data into meaningful information. That is a very important part of the journey.
Shirley, you picked up on what was going to be my next bit of question, but where does lived and living experience, practitioner insight, and academic evidence fit into data and intelligence? But I feel you have answered that through what you have already said. But if there's anything anyone would like to add on that, please do.
I think the important thing is that you can't rely on one source of information. It's that combination, even when we're working with our colleagues who've got that lived and living experience, we need to take it from a wide base. And it's actually then not just doing it once, but that continuous reset. Because what we might find out this year about where people have accessed services, how people have died, what their experiences are, it might be slightly different in the following year. But over time, and that's why it's really important that we don't just take 1 year's information and data to then help plan what we're doing in the future. We need to look at what are the trends over time, whether that's 5 years, 10 years, but it's about but small differences, small improvements can make a huge difference to what people's experience are, but also the numbers.
Yeah, I'd agree with that. With data, if you get a snapshot in time, it can be particularly useful. But when you start to expand the timeframes and start to look at trends and changes, that's when things start to get really interesting for me, and you can start to really understand what is happening in the data a lot better.
And for me, it's the question that I always ask is, but what? But
Yeah.
what does it tell us? But what does it mean? But how can we use it? So it's all interesting to look at the numbers and look at the trends and look at that information. But what? How can we use it? I think for me that's always my wee mantra when it comes to looking at the data.
Because I think that reinforces the fact that change can take a long time to actually be realised, and it's about how we're sticking to. We've got a 10-year strategy. It's how do we improve and look at what we're gathering in terms of data and intelligence. And as you say, Mary Grace, it's that bit about and what does that actually tell us? The other thing is that why are we collecting this information? We just don't do it for the sake of it. It needs to have a purpose, and it needs to help us improve the experiences of people, both who have been bereaved or also who are doing suicidal thoughts, etc. About how can we make a difference.
Yep, I'd say similar to Mary Grace. When I joined, my line manager drilled the mantra into me of, so what? Like, this all looks great, this is interesting, but so what? That's the kind of what we're getting to. It's similar to Bot-Y, but so what about this data? What can we do with it? What decisions can we make based on it that will improve the situation?
Why is data and intelligence so important to our work? And how can it contribute to our work in suicide prevention? I know we have touched on some of this in the earlier answers, but it's just if anyone's got any other thoughts on it or something they would really want listeners to know about why it's so important to our work and what actually it contributes to our work.
I suppose it really just gives, I'm trying to find what the word is, a legitimacy, I think, as well. So we might have sort of gut feelings or gut instincts in terms of what work we need to do, what and what we need to deliver, and what actions we need to take. But we need something to back that up. We need more than just what the kind of broad evidence tells us. We can all refer to various journals and articles and the kind of broad evidence round about our understanding in suicide prevention. But the data actually gives us that hard and fast evidence to target, to really inform the work we're doing. And it's that evidence-based practice, I think, that's a term that I've referred to multiple times in my multiple years of working in health promotion, and it is really to inform that evidence-based practice and make sure that what we are doing, there is reason for it.
And I suppose there's the thing is we can build that data at a national level, but it's really important at a local level to collect information, analyse it, look at what you're doing so that in fact it's responsive to what local needs are. Because what you might find that is actually required in, say, for example, the borders isn't the same actions that you might require in the Highlands or in Dumfries and Galloway. So whilst we might have generic information and data around population groups, it's about the ability to drill down into that local experience and local knowledge as well about picking that up.
Absolutely, and I think just an example of that is within our Fife Suicide Prevention Action Plan, we want to do some targeted work with at-risk groups. And my question there was, well, what are the at-risk groups for Fife? Because they could be very different depending on whether or not you're in Glasgow or in Grampian or in Ayrshire. So for me, it was like finding out who our at-risk groups actually are. And to do that, you turn to data, you turn to your intelligence, you turn to your understanding of it at a local level, and also looking at how that compares to national pictures to see whether or not our at-risk groups are, if there's like the same as the national context, the national picture, or if we are slightly different for whatever reason, so we can try and understand that as well. And that's really where the importance of data comes in too, to allow us to look at that.
I think there's also the bit is that very often at your level, in terms of local, you can collect much more valuable information and data than we can collect at national levels, because sometimes our national systems aren't as sophisticated as they could be, and we don't collect information that some people might think we should be collecting. So, for example, we're not good at national system level, not just suicide prevention, this is across the piece, in terms of collecting data around inequalities and the protected characteristics, whereas the feedback we've had from likes of yourselves, Mary Grace and other colleagues, is that it sometimes can be much easier to do some of that because you've got a bit more control over what's happening.
Well, I would say from a national perspective, data analyst perspective, in terms of the importance of data intelligence, I agree with everything that's been said. I'd also say that you can't address an issue if you don't know the issue exists, and data and intelligence helps us identify those issues as well. And the more we know about a subject, the more we can understand it. So with the ScotSID database, for example, we're able to see people's healthcare interactions. We are also planning on adding things to the ScotSID database that allows us to understand people who've died by suicide even better. And just having that and the ability to interrogate that data is a potentially valuable resource as well.
So we spoke a bit about kind of local and national there. So What sources of data are there nationally that can contribute towards suicide prevention? Like, what kind of reports do your team produce, or reports that come out nationally, Andrew?
So our two, I suppose, big hitters, as you would say, when it comes to suicide, would be the ScotSID publication, so Scottish Suicide Information Database publication, which is based on ScotSID, and our timely suicide reports, which is based on as up to date as possible information on probable suicides or suspected suicides in Scotland that we provide to local areas and suicide prevention leads to give them as up to date information as possible about people dying by suicide in their area. The Scottish publication is very much at a national level. It provides, I would say, more information than intelligence at the moment. Although we do have ambitions to kind of go further than that and drill down more into the data to provide a bit more intelligence and a bit more understanding about the people dying by suicide and the national picture. We are also developing the timely suicide reports as well to provide more information to the people who are using it.
I suppose just the more timely data comes out on a more regular basis, and really there to support local areas, identify potential trends, etc. Whereas the ScotSID information comes out once a year, and is very much linked to the national information provided by National Records of Scotland. But moving forward, we're hoping one of our aims is to link up various data sources, such as the information that's collected around reviews of deaths by probable suicide. And one of the main actions that we have under Creating Hope Together is to support local areas have an electronic recording and reporting system around reviews, which has got a large data set, which will give us more information about the engagement that people have had in the year leading up to their death in terms of services that will enhance the ScotSID report. But there's already work going on at local areas for suicide reviews, which we don't collect nationally, but that helps inform local work, as Mary Grace can exemplify.
I mean, yeah, I think I appreciate that and understand that in Fife we are really quite fortunate. We have had a process in place with local Police Scotland colleagues for a number of years now, in addition to the national information which Andrew and Shirley have talked about, which gives us that monthly data sharing. And I know some areas are even more fortunate, and they can get information almost like immediately within 24 hours. But certainly for us in Fife, we appreciate we are quite lucky. So on a monthly basis, at the end of the month, we get information sent to us from our Police Scotland colleagues. And at the moment, up until the end of December 2024, that's been anonymised data. So we get the date of an incident, we get if it's male or female, the age of the individual, the method of suicide, and we also get it broken. Some information is broken down a wee bit. So if it's been an overdose, we do get some additional information in terms of the types of medication or substance that's been used in the overdose. And that allows us to be a bit more timely in our response and our analysis of that data, because the NRS data and the ScotSID data reports, they come out on that annual basis. So in terms of the NRS data, it tends to come out August time. So, and it's for the year before. So the data from NRS that will come out August this year will relate to 2024. So if you think back to January 2024, that already seems a long way away to then wait to get that information. So that allows us to be much more responsive in terms of identifying trends, characteristics, and changes to those trends and characteristics. But that all takes time as well, because you need that baseline before you can then have something to compare to. So it can take a few years to gather that in the first couple of years where we were getting that data, it was just myself that was doing it, and I'm not great. I'm not an expert at all, and I don't pretend to be. But then, thankfully, we have now some amazing support from Claire Campbell, who is a public health intelligence manager with the public health department in NHS Fife, and she is an absolute wizard when it comes to analysis. And from Claire coming on and providing that support, the quality of what we are now getting and the quality of what we are drawing out from that anonymised data is amazing. And we now, I think we're about, and I think we're just at the end of the third year of having that. So we are now at the point when we've been able to build up a real picture of how things have changed over a few years in Fife. And from January this year, we are now moving on to the new police pro forma as well, which will provide us with even more information than what we've had before. So we will now have information in terms of contributory factors to suicide, which we've not had before. We'll have information, we'll have named information, and which we've not had before, which is very useful for a suicide prevention lead in case there is a risk of things like contagion and risk to vulnerable communities. That will give us some additional key information to be even more responsive than we've been before.
Just to flag up a kind of positive development, I suppose, with the timely suicide reports. So previously, while they were timely, they lacked certainly the richness of information that Mary Grace has access to in Fife. With our adjustments to how we do the timely suicide reports and the data sources that we use for it, they won't be quite as timely as before, a couple of weeks extra lag, but we will be able to provide more information than was previously given. And they're also able to update on a regular basis. So as NRS updates their records in terms of what were suicides and what were not suicides, our report will be able to update as well. So won't be able to give as in-depth and as rich information as the information that's available in Fife, but it will improve the offering that is available to across Scotland, the local authorities that we send it out to.
I think what you've both demonstrated is that what we're trying to move towards is that every area has at least the minimum more information, but also the value of partnership working is that this isn't just about information that's provided by public health or suicide prevention, it's linking in with all the potential points at which people engage, whether that's Scottish Ambulance Service, Police Scotland, our third sector partners, and it's about how do we collate all that information together to give us that richer picture. One of the other sources of information that we haven't mentioned yet is distress brief interventions. And whilst that is a programme that is there to support people who are having issues in terms of their wider mental health and well-being, it is also picking up some data around suicide prevention, self-harm, etc., which is providing that richer picture of where people are engaging with our unscheduled care, so accident emergency, our first responders, etc. So again, it's about part of this work is about linking other sources that might not just have suicide prevention in their title, but have got an impact on people's wider mental health and well-being.
And I was just going to say, actually, Shirley, on that vein, we've, in Fife, we've got a really good process now in terms of the completed suicide data, and we've been working away in that for a few years now. So we are trying to broaden out to look at other sources which will move down that pyramid a wee bit and look at attempted suicides and presentations. And as we know, there are so many challenges in terms of that because there are so many places and so many agencies and organisations who can hold data in relation to that. So where we've been working is with Scottish Fire and Rescue Service as one example. So they attend presentations and suicide attempts depending on circumstances, and we have again got a really good relationship and partnership with Scottish Fire and Rescue Service in Fife. So they provide us again with data in terms of all the call outs they attend where it's a concern for welfare or attempted suicide, which Claire Campbell then she includes that in terms of the work that she's doing, and that really broadens out work when it comes to things like locations of concern. So we're not just looking at completed suicides to give us an insight and evidence round about locations of concern. We're able to identify them where there have been presentations, which if it was just based on police data, we wouldn't be picking up, because it's the only data we get from police data is the completed suicides. But the Scottish Fire and Rescue Service data gives us another level of information that we can, and I don't know if you would describe that as intelligence or data, or given the kind of conversation we had earlier, but that additional level of information that we can then act on in a more timely way. We've also been looking at, and I'm saying we, royal we, it's Claire Campbell, the wizard, that's been doing it. But she's also been looking at admissions, hospital admissions, as a result of intent to self-harm. So that's given us another source of information on top of what we have from Police Scotland and Scottish Fire and Rescue. We are still trying to figure out what we do with that. So that's coming back to your point, Andrew, about the so what. So we have the data in these reports and this information, but for us now it's, well, so what? How do we use this? What can we do with it? And the other place we're looking at is Claire's also done a breakdown of the NRS data to locality level in Fife. We've got 7 localities within Fife, and she's broken down that NRS level, and she's done all kinds of trends and things with that information, which again has given us another level of information in terms of our broader understanding in general of the picture. So there's lots out there, but again, I'm really fortunate that I've got that support and that capacity, who's able to, and Claire and her colleagues, who can do that work for us to ask the questions, so what?
I mean, for me, and just quickly, that's a fantastic example of information going to intelligence. So you've got different sources of information that are being brought together to create a better understanding, and that's what's leading to intelligence for me. So we're not just talking data, we're talking sources of information and actually bringing them together. So I think that's a great example of how information can move to intelligence.
And I suppose it's an example of where you've got really effective partnerships, because one of the challenges we get faced with, particularly when you're talking about presentations and attempts, because we are talking of people who are still alive, in terms of how do you share that data across partners in order to have that better intelligence. But one of the things that's coming up is about how do we kind of like encourage that public protection aspect, so that if you are sharing information, it's on that need to know in terms of public protection, in terms of if an individual is presented a number of times at a particular location. By sharing information, we can do much more to intervene and support that person, rather than waiting to potentially a death by probable suicide. So it's about that kind of like rich partnership working that you have. And very often, if people are, got suicidal thoughts or presentations, even asking the question, am I okay to share this information with others? And more often than not, you will get the answer yes. So you don't necessarily need to go down that adult protection route. It's that, and that's the experience for other topic areas as well. Is that very often we don't allow for that positive response to be, because we're frightened of getting a negative response. But I think that's it about, is collecting the data is really important, and then what do we do with it to answer the so what question is the fundamental take home message. But not just collecting data for its sake, but looking at all sorts of different sources. So things like DWP, so people attending for money advice and things like that. How are we collecting that kind of softer information? But I'm sure Andrew's got the answer.
Oh, I certainly have no answers. I was just picking up on the point in terms of data collection, data management, data sorting, data analysis. It's a lengthy process, particularly with information governance and data protection, particularly the data that I work with on the national level. It really makes our life within my work area, my team, a lot easier if the questions are defined and tight and people let us know exactly what they want. So if people can come in with an idea, a specific idea of what they want to know, it means that we can be more specific about what sort of data that we go out and get. So we don't want to just add in data willy-nilly, because that's very time consuming. It has a cost implication as well. The more we know about what people's interests are and what they want to know, the more specific we can be with how we go about our data collection and our data analysis.
It's a bit like those kind of Russian dolls, I think, data as well.
Yeah.
So, so you get one level of it, and you have a look at it, you think about it, and then all of a sudden it's like you take the lid off and all this other stuff comes out that you need to try and find out about. And that's certainly the image I have in my head of it. And I was rubbish at maths at school, and I now spend a ridiculous amount of time looking at numbers and charts and graphs. So yeah, it has been a bit of a turnaround in terms of what I thought I would spend my time doing in this role as to what it actually is.
But that raises another bit about sometimes we produce all these reports and people go, and what does this actually mean?
Yeah.
It's it's all very well having confidence intervals and all that kind of like stuff that I did at university in terms of my statistical module, and you've forgotten about it all and you have to revisit it, but you just think, what does this actually mean for people on the ground? And it's about how do we enhance some of our work that's around that data and intelligence, about saying this is actually what this really means. And that's why it goes back to our kind of like discussion about just don't take 1 year's data. You have to look at what is it, because the way that our particularly our deaths by probable suicide they go up and down. There's a bit of a consistency, but 1 year we might be more, 1 year might be less, but it's about what are the things that we're doing that is actually making that difference, and how do we capitalise on it so that we can actually make sure that no one in Scotland is not getting access to the information or the services and support that they should be getting to because of where they live.
And just to pick up on that a bit, one of the biggest challenges I have as a data analyst is presenting information that is meaningful and accessible to the users. So with the ScotSID database, we could produce a ridiculous amount of outputs. Like, we could do so many different charts and tables and graphs and lots of different statistical testing, but that's pointless if it doesn't mean anything to the people that are accessing it. And it's difficult if you're kind of silo working to get that, and that's why we need to get more engagement with people who are actually using the data and understanding what they want out of it and what actually has a meaningful impact for them in terms of increasing their understanding and getting to that kind of intelligence point. And that's kind of the goal of what we're trying to do with ScotSID with recent developments. We want to produce more. We want to be able to say more with ScotSID, but at the same time, we don't want to overwhelm people and confuse people with reams and reams of data or meaningless information. So it's quite a back and forth process, I think it's going to be, in terms of improving that to the point where we are providing better intelligence, but in a way that is easily digestible for the user.
But sometimes we're not collecting the information that people want. So, so we can do some analysis, but there's others that we could be doing better with. So like the equalities data is one of the things, the real differences between remote and rural areas and urban areas, whilst we do stuff on deprivation. Even the classification of deprivation misses some areas that might not just be about monetary issues. It's about that kind of like the kind of like wider determinants work about people and what people are facing with.
And it's a process as well. Sometimes you don't actually know how you're going to use it until you have a penny dropping moment. So, for example, we've used, the work that we do with the data in Fife doesn't just sit on reports and on servers and shared and secure drives. It's used. So we, for example, one area of work is the locations of concern work, which I've already spoken about, and how we use that to identify potential locations that we wouldn't be aware of had we just looked at the completed suicide data. And that then allows us to inform action within the location of concern group. If there's a particular location which has seen more activity than we previously were aware of, we would then look at using like the locations of concern guidance and put in place actions to address that. But another area, and it's going back to a point you made earlier, Shirley, about the DBI service, is that we actually used the data to inform our rollout of DBI in Fife as well. So we looked at that locality level data in terms of completed suicides and presentations and that work to look at what localities, how, because the DBI rollout didn't happen in one go in Fife, it was across the 7 localities and a rolled out approach. So that was part of the data and information and intelligence that was used to inform what order the localities received that rollout. And it was the suicide data was partly part of that process, which prioritised some areas to get the DBI service before others. So we do absolutely have that question in our minds when we do the analysis and we do the work round about it. How are we going to use it? And importantly, how we share it safely as well, and who with. Because the last thing we want to do is cause panic, especially if you're looking at data at potentially locality level. The last thing you want is people thinking that there's a particular area of Fife that's got like a crisis when it comes to suicide, and it's about keeping it keeping it relative. I don't know if it's relative is the right word to describe it.
In perspective.
That's the word, Shirley. Thank you very much. In perspective. So we are cautious about who we share it with and how it's shared, so it's not used to kind of cause panic as well unnecessarily.
So just picking up on that, one of the things that we do get information on is methods that people use in terms of in either to attempt or a complete suicide. But that's useful information about what we might do to prevent that method being used in the future, but both at local level but also at national level. But again, it's about being really careful about how that information is presented in order not to actually so it's raising awareness to a level at which, yes, be aware that this may be an issue, or it's what do we do about it, and is there something that we do nationally or something, or is it a local issue? So it's about how do we gather that information together to build up that picture, both in terms of trying to do prevention, because our whole activity is around suicide prevention, not just responding to deaths by suicide. So that's an area that is becoming work in terms of the data that we're sharing and the intelligence about how do we use that, both on a Scotland-wide basis, but sometimes on a UK-wide basis as well, because we work quite closely with our partners out with Scotland in terms of sharing some data around particularly methods that are emerging or long-standing.
So we're beginning to get to the end of the podcast now, actually. I can't believe how quickly the time has gone listening to you all. And I remember a couple of people saying to me that data and intelligence wasn't an interesting topic to talk about in a podcast. And, since we started this, I found it very interesting. If there was one thing each of you would like to see people doing around data and intelligence, what would it be? Or do you think that there's anything more that people could do?
Not be scared by it, I think, for me. Because everybody's brains work slightly differently. My minds don't really work with numbers, but I've been able to use data to our advantage. So not to be scared by it, because there are people out there who can support and guide you in terms of drawing out from it what you need to understand from it. So not to be scared to use it, and also not to be scared to consider how we can share it across partners and agencies as well. Because it is, it's going to sound really cliched, but it is for the greater good. We are doing it for a reason, and it is to save lives. So the more that we become comfortable with what we can share and do that, then that's all going to be for everyone's benefit.
From my perspective, I may regret saying this, but get in touch. Since we started developing the timely suicide reports, which was prompted by some people getting surprised by figures, I've had a lot of conversations with local leads about what their interest is in the data and how they would want to use the data, what they would like to see, and it's really helped us focus on improving what we're offering, and we've been able to do some ad hoc work as well for people. it's not the sort of thing that my team could do indefinitely, but the more people contact us, the better idea we can get what would work on a national basis. That would then be kind of filtered out to a more local level. So I would say to people, don't be afraid to get in touch with us and have a conversation about what your data needs are when it comes to suicide data and suicide prevention.
I suppose for me, it's really about being really clear as to why you're collecting the information, making sure that we've got those principles of getting feedback from people with lived experience, the academic and practice, and actually looking at how can that help shape our responses moving forward, and also not just to concentrate on suicide prevention data, because we know that people who have suicidal thoughts, suicidal behaviour, are experiencing challenges in terms of cost of living, deprivation, etc., etc. And how do we marry that all together to give us a better picture of what people are experiencing and what our service responses are? And as everybody said, is that it's not the scary thing, but involve lots of people who have got skills, knowledge in order to help us make a difference.
Really does come back to that suicide prevention's everyone's business. But thank you all for taking part in the podcast today. It really has been great hearing from you, and I'm sure you will probably get some questions and people contacting you around this. Andrew, you may very well regret saying that people can contact you and feedback with stuff, but I suppose people can also feed information back or questions via their local implementation leads as well. But thank you all as well for listening, and if you have any questions, there will be an email address or something to pop us a wee question or leave some feedback on the webpage this is hosted on. And it has been a pleasure chatting with you all.
Thank you.
Thanks for
Thank
having us.
you.
I'd like to thank Andrew, Mary Grace and Shirley for joining us today on the Creating Hope podcast, and I'd like to thank you for listening. If you are concerned for yourself or someone you know, please know that help is available. You can call Samaritans on 116 123 or use the online chat at samaritans.org. Alternatively, you can contact Breathing Space on 0800 83 8587, and you'll find the NHS 24 Mental Health Hub, where you can speak to a specially trained mental health advisor by dialing 111. And if you're ever in immediate danger or have the means to cause harm to yourself, you should dial 999 and request an ambulance. Thank you again for listening, and take care.